Hi guys. So one of the very common questions I'm asked about is whether or not a person that just graduated from university in medicine or um, is a medical student, what examinations they should do, whether it be Plab versus the USMLE examination. So here's the thing: you have to make your decision based on what you one can afford and two what you think would strengthen or be in the best interest of your career. When you do plab, which can only be done after you have graduated from medical school, you have to then go and do your foundation year. Well, this is if you just graduated. So if you graduated, for instance, in 2018, which is this year, when you do plab, you then have to go and do your foundation year one and foundation year two in the UK, or do your internship in your country and try to get into an SHO year in the UK. Plab questions are specifically structured to be more uh, direct. And when I say direct, it's considered an easier exam, but I don't think it really is an easier exam. It's just worded differently. So the content of the actual examination is pretty much what any medical doctor should know. So it's making sure that you come up to the level or come up to the level of a first world doctor, which is a UK trained doctor. First world. USMLE, I think, is a trickier examination, but the content of the examination might not necessarily mean that it is harder than PLAB. It's just a situation where the the questions and the time in which the examination is set out. For instance, it's an 8-hour exam. It's set out over such a long period of time. You literally will feel drained after you've done one exam. So I won't tell you that it's easier. And let me just also mention that I haven't done USMLE or I haven't done PLAB, but I have a lot of friends who have, and I also have a lot of cousins who have done USMLE and are working in the US right now. Nephrologists, oncology, you name it, they've done it, and they were international medical graduates. So they got through, and it's possible, clearly. And they got through to very difficult specialties. I have a friend who even matched for neurosurgery in the United States, and he's an international medical graduate. So that's just telling you from that point of view. PLAB is better for me, if you have just graduated. Like, for instance, if you graduated this year, do PLAB. And that's if you want to go to the UK. If you have the resources after you have graduated from university to go on and do USMLE and take time off and study for USMLE, at least step one, to take time off and study for it, go ahead. Or if you feel as though your clinical experience is a lot better, so you can do step 2 CK, you don't have to take time off. Do step 2 CK, practice on the wards, practice your OSCEs or your examination skills on the wards, so you can take 2 CK and 2 CS at the same time, which is what a lot of people do. Don't make your decisions based on the money. Like, that's like, when I say money, not money to spend for the exam, but people make their decisions based on which country pays more. That's not a good idea. Work-life balance is what we all aim to have, because most of us want to have a family as well as a good career. USMLE, as I mentioned, the questions are much more difficult and in terms of how they're structured, but the content when compared to PLAB, no, I can't genuinely say. And I've reviewed a few PLAB and USMLE questions, and I will say USMLE questions are much longer, like longer, and you have a lot more to do in that short space of time to answer those questions and make sure you don't leave out any questions. What you need to study for the USMLE examination, everyone knows it's UWorld and First Aid. Some people use a Kaplan book, some people use a whole set of resources. Me personally, I am not a person who learns with videos, but people recommend the videos as well too. Um, my life is really busy, so I haven't really been finding a lot of time to study for the USMLE. I have a day off kind of today, and I was saying, okay, someone on my channel asked about USMLE versus PLAB, and I just said, okay, let me just, offer my input. I don't have to do PLAB now because I did the MRCS examination, which is a UK exam, and I don't think PLAB is necessarily appropriate for a person who graduated. I graduated in 2013, so I'm already 5 years into being a medical doctor. So I don't think Plab. I didn't think Plab at the time was suitable for me, and I wanted to do surgeries. That's what I want to do. I want to be an oral and maxillofacial surgeon. So I didn't think Plab was for me at the time. USMLE is good throughout, and the reason why I'll say that is once you finish USMLE, even if you haven't matched, which most times people match to internal medicine, that's what everyone matches to. Like most of my friends who have done it, last year it was they matched to internal medicine. Most, pretty much 9 of 10 people matched to internal medicine. I think one person matched to ONG, and I think that was what they wanted. They wanted to go to internal medicine. So when you do it, even if you don't match, you can still apply for fellowships later on, which will require that you do the USMLE so that you can touch patients in the United States and your degree is registered there. And that is another benefit. My advice is to sit down and work out how much money you have and money and time you have available. If you have money and you have the time, take the time, maybe 5-6 months, to study for the step 1. If you have graduated like me in 2013, do the steps, but start with step 2 CK, and then afterwards see how that goes, because step 1 is considered the most important. So you need to take time for that. Step 2 CK and step 2 CS is what we use daily. I work in accident and emergency, and I work in general practice, and I'm, like I said, I'm a dental student as well too. So a lot of the stuff that you learn in step 2 CK, you use on a day-to-day basis. So you don't want to risk getting a low score in step 1. But I will say this: if you have just graduated from medical school, do step 1. Take the time off. But if you're like me, experienced, because I'm not tooting my own horn, but I mean I still have 5 years into being a medical doctor, do step 2 CK, because a lot of the clinical stuff, not the clinical, the basic medical sciences would have been rusty. Like when I review stuff, I am lost, and that can be discouraging. Another thing too with Plab, just like I said, once you do the Plab, you go to do your foundation year 1, foundation year 2. When you do your foundation year 1 or foundation year 2, you can then do membership examinations in the UK, which should be like to the Royal College of Surgeons, like I did. I skipped Plab and I did MRCS. But if you are just a person that's just graduated, you can do the Plab or MRCS if you want. But this video is about Plab and USMLE, so I'm giving you that from that perspective. Plab limits you a bit in terms of your advancement in the UK system. You still need MRCS or MRCEM or MRPsych or MRCP or any of those examinations to go to rise, or to even get into the the core training programs, or the core surgical training or medical training or psychiatry or GP. You still need those membership examinations to rise. So for me, and for those who have been medical doctors for some time, I don't think, if you're looking at the UK, Plab is for you, because you may have to go back to go forward. So you may have to start as an SHO, even though you might have been a consultant in your country. You have to go back to SHO or to a foundation year before you go forward. And that may not be pleasant for many persons. It may be more money, mind you. I said don't focus on money, but it may be more money than what you make in your country. But it doesn't necessarily. It's not a very nice feeling to know that you are a consultant in your country, and when you go to a first world country, you are at the bottom of the pile, just above an intern, but still at the bottom of the pile. I've had to do it in the sense where, as a person who's graduated, so in 2013, as I'm working accident and emergency, I've actually had to revert back to what I was 4 years ago, technically, because I'm a medical officer 1. It goes up to level 3, but I've graduated for 5 years. So right now it's a humbling experience to be, working at the bottom of the pile, and that's something that you may have to go through in the UK. And you may also have to go through in the US, because who knows, you may be a consultant in your country and you want to do USMLE to match for a program in the United States. You still have to bear that in mind. You have to start back over. So you might have been a gastrointestinal specialist, you might have been a general surgeon consultant in your country, but you will be a PGY1, postgraduate year one specialist in the United States, a resident in the United States. So just keep that in mind as well too. In terms of money for the exam, USMLE is about 10 grand in total if you count up all the traveling back and forth with visas and the cost of the exams. Plab is considered cheaper. It is cheaper. You need IELTS, I think, for both. For those who are English speaking or from English speaking countries or English speaking taught degrees, you may be able to get exempted from that, but just bear that in mind as well too. The format of the examination, Plab, is much shorter than the USMLE, but there is a benefit over. This is one benefit I found with USMLE over Plab. So even if you don't want to set the exam itself or to actually do the USMLE examination, the content within the USMLE opens your eyes to so many things that you might not have paid attention to just working in the post that you're working in. So it's a way of continuing your education. I think that is a big benefit to the USMLE. In terms of rising with it, even if you do it and don't match, I'm not certain that many countries use it as an advancing qualification, but it still offers you some knowledge that you won't get any other place. So as I mentioned, for Plab, you have to consider starting over. For USMLE, you have to consider starting over. USMLE is more expensive. UK is less expensive in terms of the exams. The exams for Plab is more structured to final MBBS or MD exam. USMLE is structured that way as well too. USMLE, if you match, you go straight into a residency program. If you do Plab, you don't necessarily go straight into a residency program. You might have to start over, and you may not get into a residency program. You may work at the same post that you applied for when you went there to the UK. You might work at that for the next 4 or 5 years, and there's nothing wrong with that, because you can still do your membership examinations. You can still live, function, and be a decent contributing member of society in the United Kingdom. So that's a plus. In the US, you go straight into a program, or you might just do an internship year. I see there's an internship year for plastic surgery. So you have to consider that that's a very big plus. Your life has direction in the US versus the UK. There is direction, but there's no guarantee you get into a program. So I hope I've offered some insight. This is my 2 cents. I'm not an expert on either of them. Remember, I said I haven't taken USMLE or the Plab, but I have studied for USMLE and I've taken the MRCS examination. So I have an idea about the UK exam, okay, and the US exam. So I hope you like this video. Please subscribe, and if you want to get the videos, they want them to come up in your feed as soon as a video is posted, just press the little bell. Okay, cheers.